I assist Ms. McKissack with lectures and other areas of your learning experience. With that being said, I will be completing the remainder of this lecture. Let's begin with the electrocardiograph and sensor placement. The standard ECG consists of 10 sensors that record 12 leads of the heart's electrical activity from different angles. The electrical impulses given off by the heart are picked up by the electrodes and conducted into the ECG machine through lead wires. The electrodes are placed on the patient's forelimbs and chest. The forelimb leads are placed on the fleshy non-muscular area of upper arms and lower legs. The chest leads are known as precordial leads and use an electrode for each of the 6 areas on. Diagrams illustrate the electrode and lead wire placement as well as an example of a single-channel ECG machine. The value of an ECG recording depends on it being performed accurately. Also, to ensure a precise and reliable recording, standardization of your ECG machine through regularly scheduled maintenance is required. Standardization measurements have been adopted internationally as a measure of accurate calibration among all electrocardiographs. Of the type of electrocardiograph being used, the basic components of a standard electrocardiography remain the same. Patient preparation, lead placement, and elimination of artifacts vary little from one electrocardiograph to another. Let's watch a quick video demonstrating how to perform an ECG.
Patient prep procedure. The patient prepares by removing the necessary clothing. Once the patient is ready, take a moment to explain the ECG test procedure, answer any questions, and assure the patient that they will not experience any discomfort. When performing a resting ECG, it is very important to ensure the patient is in a comfortably warm room and is relaxed prior to the test. The quality of the ECG depends greatly on the strength of the signal derived from the electrodes. To provide the best contact, it may be necessary to shave the contact area prior to cleaning. Thoroughly clean and prepare each electrode site with alcohol, and allow each area to dry before placing the self-adhesive resting electrodes. Start by placing the white RA lead on the right arm a few inches from the inside of the wrist. Then place the black LA lead on the left arm. Place the green RL lead slightly above the ankle on the front part of the right leg. Then place the red LL lead on the left leg. The left leg placement is critical since this is the grounding electrode. If this is not done correctly, there will be no conduction, resulting in no ECG waveform. After legs and arm are done, move to the patient's chest area. The tech should find the clavicle, then place the red V1 lead at the right sternal border of the fourth intercostal space. Place the yellow V2 electrode at the left sternal border of the fourth intercostal space, approximately 3 inches apart. Place blue V4 at the fifth intercostal space on the mid-clavicular line. Green V3 should be placed in a straight line directly between V2 and V4. Orange V5 is placed directly on midline, even with V4, and staying on the same line. Place violet V6 on the side. This illustration shows where the electrodes should be placed. Connect the lead wires to the electrodes. Once all electrodes and leads are placed, you are ready to perform the ECG.
As the medical assistant, you are responsible for obtaining an ECG recording that can be easily read and interpreted by the provider. There can be unusual or unwanted activity in the ECG tracing not caused by the electrical activity of the heart. These defects in the ECG tracing are known as artifacts, and their appearance can make the ECG tracing difficult to read and interpret. Their four most common artifacts are somatic tremors, AC interference, wandering baseline, and interrupt. Listed here are the definition for 3 of the most common artifacts. The 4th artifact is an interrupted baseline, which is an interruption in the baseline. Causes include a broken cable, a lead wire that becomes detached from an electrode, or an electrode that has come completely off. This photo is a visual representation of a somatic tremor. This reading should not be submitted to the provider. Instead, you will need to make the necessary corrections and perform another ECG tracing. This photo is a visual representation of a wandering baseline. This reading should not be submitted to the provider. Instead, you will need to make the necessary corrections and perform another ECG tracing. This photo is a visual representation of AC interference. This reading should not be submitted to the provider. Instead, you will need to make the necessary corrections and perform another ECG tracing. Let's change gears and discuss heart conditions. Myocardial infarctions, most commonly known as heart attacks, are the leading cause of death in both men and women in the United States. Behaviors to adopt for a healthy lifestyle include avoiding tobacco products. Take medication as prescribed. Report any unusual symptoms or issues to the provider. Eat a low-fat, low-cholesterol, low-sodium diet. Exercise regularly with provider's permission. Get adequate rest. Keep weight at an acceptable level. And practice stress reduction behaviors. Any ECG reading that is not a normal sinus rhythm is considered a cardiac arrhythmia. It is your responsibility as the medical assistant to recognize cardiac arrhythmias that occurred during the ECG recording. Also, you must inform the provider. And in doing so, you must not alarm the patient. Sinus bradycardia and sinus tachycardia are considered cardiac arrhythmias even though they are regular in rhythm. Ventricular arrhythmias can be seen in healthy individuals and in patients with hypertension, coronary artery disease, and lung disease. In healthy individuals, PVCs can be caused by tobacco, anxiety, alcohol, and medications that contain epinephrine. Ventricular tachycardia is seen in patients with cardiac disease, most commonly coronary artery disease, and those experiencing a myocardial infarction. Ventricular fibrillation is seen in patients experiencing a myocardial infarction or in patients with existing cardiac disease and may be preceded by PVCs or ventricular tachycardia. Defibrillation is the application of countershocks to the heart. The purpose is to convert cardiac arrhythmia into normal sinus rhythm. Oftentimes the office's defibrillator is kept on a crash cart or centralized location. CPR and AED performance will be discussed in detail in the Chapter 9 lecture. During the remainder of the lecture, we will cover other cardiac diagnostic testing, starting with the Holter monitor. The Holter monitor is a portable continuous recording of cardiac activity for a 24-hour period. The patient is monitored while going about their usual daily activities with no restrictions. Once the Holter monitor is attached, the patient needs to keep a diary of their activities as noted on this slide. Patients should be instructed not to shower, bathe, or swim while wearing the Holter monitor. Also, instruct patients not to use an electric blanket while wearing the Holter monitor. Occasionally, patients have symptoms that do not appear on as abnormalities on their resting ECG, therefore the provider may prescribe a treadmill stress test. This test is non-invasive ECG tracing conducted while the patient exercises on the treadmill at prescribed rates. Thallium stress test is similar to a treadmill stress test with one exception. The patient is given an injection of a radioactive substance. The test shows how well blood flows to the heart muscle. Also, patients who cannot tolerate an exercise stress test can be given a vasodilator and undergo the ECG test while seated. The medication will cause an increase in heart rate, thus simulating the stress of walking on a treadmill. Thank you for your time. I hope you enjoyed our lecture. If you have any questions, comments, or concerns, please discuss with Ms. McKissack during the next class session.